What's up, family? Patreon family, how you doing? Oh my God. All right, so this is the live. Actually, this live is unlisted, so only Patreon, only people who tune in to Patreon can see this video. So it's gonna be half of it, it's gonna be public for everyone, and the other half is gonna be for you Patreons only. So we're gonna talk about nurse bullying. Oh my God, nurse bullying! Can you believe it, guys? It's huge. I'm telling you, it's huge. Don't feel that you are the only one who's being bullied. And don't feel because you are bullied, then that's the end of the world. Don't feel because you're not getting along with your manager, with your colleagues, with your charge nurse, supervisor, nurse coordinator, or nurse director, then that is the end of the world. I want you to be patient. Just sit back and reflect. You know, what's going on? Why? I'm making a video. Look at these pimples, guys. I don't know, as if I'm 18, as if I'm back to 18. Look at these right here. Then I've got another one right there. Breaking out. Stress, hard work, hustle. Hey, listen, what do you want? No, you cannot sit on my lap because I'm making a video. Okay. And?
I know I can sit on you.
No, don't sit on me. I'm making a video. All right, guys. So, nurse bullying. I'm going to tell you a little bit about my experience. And, I mean, you guys can see I am pretty successful. So, my career didn't stop on that charge nurse or on that nurse manager or on that nursing director or program director whatsoever. If you have it in you, then you can get anywhere you want. You just need to be wise and you need to be smart about, your day-to-day life. And then, I mean, no one stays in his place. Like, no nurse manager will stay in the same position. It rotates. And hey, listen, if you are right, if you are being bullied, then karma will hit the bullier in the back one day. So let's talk about my experience. I don't know why this camera shuts off every like 2 minutes or so, but ICU. I started my career in ICU. It was amazing. I thought I'm the smartest nurse on earth. Like, I mean, obviously I was one of the smartest registered nurses on the unit. I remember there's a guy called, his name is Abed Jamal. Oh my God, he taught me everything about ICU. But the thing is, he likes a lot of theory and he likes a lot of practice. So we used to like intubate patients. We used to insert central lines, like every procedure you can think of, like subclavian central lines, femoral central lines, internal jugular central lines, intubation. It was, oh my God, it was crazy. But then after I left that ICU and I went to a big magnet hospital back home, the American University of Beirut, I figured, oh my God, I mean, that's not nursing. All these like procedures and intubation, all that kind of stuff, that's not nursing. We were not concerned about like bed sores, quality indicators in general, like bed sores, central line stream, preeclampsia, central line bloodstream infections, or like falls, or like ventilator associated pneumonia, or those quality indicators. We were not concerned about them. We were only thinking of like, hey, I can be a doctor, I can do what a doctor does. Oh my God, I mean, like, if you do that in the States, you get in a lot of trouble. Even if in other hospitals like magnet facilities, I mean, you should work within your scope of practice. You cannot do shit that is not under your job description, right? So anyway, great experience from ICU. I learned a lot. Then I moved to pediatric hematology oncology, like pediatric hematology oncology. And I was like, what? Like moving from critical care to pediatric hematology and oncology, I was freaking scared. Like I was frightened to death. But I loved it. Changed my life forever. Hey, look at him. Look at him. It's fine. So what I did, it's okay, this hand is clean. So what I did is, I mean, right from the top, when you work in a magnet facility, they would like to teach you professional development, like how to pursue your career. And since then, I was thinking about certification, like getting certified as a pediatric hematology oncology nurse, joining professional organizations, stuff like that. So when I only worked there for like less than a year. So when I moved to Saudi Arabia, and I worked in Saudi Arabia for like 6 years or 5 years. Oh my God, I'm telling you, I went there with so much confidence. So I started working in bone marrow transplant unit for peds. And, you know, working there has been amazing. I picked up the pace very fast. I was in like a unit-based council committee. I was co-chairing the unit-based council. And then I was chairing the unit-based council. Then I went up and I was the chair of the professional development council on the divisional level. So it's not like unit level, but it's divisional level. So I'm a chair for multiple units. I was working my ass off. When I get back home, I was like looking on the internet, new like articles, new studies, whatever is new in bone marrow transplant and in oncology, I was on the top of it. Me, my personality is I like attention around me, right? That's why I work hard. I look for the latest evidence, for the latest conferences, for whatever is new, I get on top of it. I try to learn it, and then I try to teach it to others. So I've been on top of things. And then one time I had I had a medication error, basically. It's not a medication error, but it is a medication error. So I gave PRN Tylenol, and I didn't sign it, on the MAR, electronic MAR. So I gave Tylenol almost at 6 in the afternoon. I didn't sign that I gave Tylenol, but I wrote in my plan of care, patient was febrile, I gave Tylenol, this and that, checked fever again, and temperature is subsiding. Excuse me. But the thing is, I did not document. So if the night shift nurse came to the shift and she found the patient febrile and that she wants to check the records, then the last time the patient received Tylenol was at 12 noon. But last time he received Tylenol was at 6 p.m. So the nurse actually picked up, the error before she gave Tylenol. She checked the temperature, and even I endorsed to that nurse. But that nurse is a freaking, I'm telling you. So, and I don't have anything against Filipino nurses. I love them. I have tons of Filipino friends. But that nurse was Filipina, and oh my God, she was a freaking, I'm telling you, she was like 55 years old, and senior nurses, they don't like new nurses who have that energy and stuff. So she was like picking up on me, and one day, like, she caught me. Anyway, I endorsed to her, but then when she checked, she saw that I didn't sign it, but I wrote that in my notes. So she put in a what do you call it, like an incident report. That's fine. If I was in her shoes, I would just call the nurse and tell her, when you come tomorrow morning, sign the medication because you forgot to sign it. It's you forgot to sign it. That's what I would do, because in the policy you have 3 days to sign. They allow you, they give you a margin of 3 days to sign medication on that EMR. We used to use Cerner, and the software is ICIS. ICIS. We used to use that. Hey, go clean your hands. Anyways, that's what the nurse did. And then my manager was, like, oh, you did an error. We have to sit down, do a reflective practice, go through the whole process. I felt I was humiliated. Like all the work I do on the unit, all the awareness regarding certification, professional organization, the work on the unit-based council, the ideas for improvement, and then you come to me and you put me in the same category. Please give engineer a pacifier. This time, give it a pacifier. Then you put me in the same category of people who are careless and who needs education. Anyway, she gave me a reflective practice to fill. And you're not mature, and you're like, I was 26 at the time, something like that. And you're not mature, and you don't know how to deal in professionalism and assertiveness. So what I did, I I put in that reflective practice. Oh, that nurse is bullying me, and I remember her name. Her name is Baifa. Baifa. I think her name is Baifa. That Filipino nurse. Baifa. I don't know, something like that. But anyways, she's bullying me. She's stuff. She's this. She's that. And I did not acknowledge my mistake. What I should have done, I should have said, I did a mistake. You should not put excuses when you're reflecting on your error. So what I should have done, I should have said, I did a mistake. I didn't follow policy and procedure. I didn't follow my 6 rights, because the 6 rights, the last one of the 6 rights is documentation. So you need to document. So, and I'm gonna put a plan for myself for the next like 3 months or so to, it's not a plan, but I'll say I'll ask a buddy, from my coworkers to double check my MAR for the next 2 weeks. You don't want to make it 3 months, because that's an extra burden on the other nurse. But if you and the other nurse are on good terms and he approves it, then okay, by all means, do it for 2 weeks, a month, or whatever. So you need to put a plan for this mistake not to happen again, and you need to be like assertive and be accountable, because you did a mistake and that could have harmed the patient. So it was not like an error. It was a near miss. Anyways, that's what happened. But because I didn't acknowledge it, oh my God, like the doors of hell opened on me, and they forgot all the good work that I've been doing on the unit for the past year. And Noah, please stop making noise. So they forgot everything, and I actually had a promotion. I got a Noah, please stop. No. And I actually got a promotion like a month before. I was promoted to a clinical instructor, and then what happened is that I did that error, and like they give you like 90 days to release you to the new position. I was only like 35 days in. And then I did that error, and because of the way I handled it, then they asked me to resign, to demote myself. They asked me to demote myself. So I was fighting it. I went through the chain of command, hire people like, program director. And I went to legals and I went to the program director, but they said, hey, dude, your manager doesn't want you. Your new manager does not want you, then you just demote yourself. So that's what I did. I did the demotion, and I was back at the bedside. I was frustrated, but I wanted to prove everyone wrong. I wanted to prove I still wanted the attention around me, even though the attention I was getting at that time was negative attention, because the way I handled it, the demotion, the way I was saying at my coworker that she's a bullier. She was a fucking freaking bullier. But, I was saying in public, she's a bullier. Watch out from her. I did a terrible job. I mean, I wish I had someone to coach me through that, like how to handle stress, how to handle like problems at work, bullying. I wish there was someone at that time who have coached me or taught me how to handle those kind of situations. There wasn't. After that incident, I started reading a lot about emotional intelligence. And I would suggest, if you're watching this, and if you're facing some kind of troubles like, nurse bullying, you don't like your charge nurse, nurse manager, whatever, read a lot about emotional intelligence. Oh my God, it will change your life forever, because you need to be wise about your career, about every step you take on every single day with that particular person. So, anyways, that's what I did. I did. Oh my God, it's freaking snowing. Like yesterday, we were wearing t-shirts. Today, it's snowing. This is the Midwest, guys. Okay, so this is what I did. I demoted myself. I had so much negative attention around me, and I wanted to flip it to positive attention. And the only way to do that was to get my specialty certification. So I applied to the certified pediatric hematology oncology nurse, me and my clinical instructor. And then both of us went and did the exam, and both of us failed it. Oh my God. Excuse me. Like, both of us failed the exam. Um and then I said, hey, I hanged my results on a whiteboard. As soon as you come into the unit, you'll see the results. You'll see that big fail. But what I wanted to do is, because everyone was afraid of applying to certification, specialty certification. So what I wanted to say, okay, I did the certification. I paid like $500 or $600 or so. I failed. This is how they grade you. I'm gonna learn from them. I posted them so that everyone can learn from them, and then I'm gonna move forward and um, do my specialty certification next year. Oh my God, I messed up the times. No, no, no. Actually, that was the year before. So when I did the medication error, I said to myself, I have to sit for the exam again and pass it, and then I'll get positive attention around me again, because um, it has never been done before. Like, I will be the first certified pediatric hematology oncology nurse in the hospital, and not just in the hospital, hey Amani, but in the whole Saudi Arabia. Can you freaking believe it? So I said to myself, I got demoted, and I lost that position. So I said, I'm gonna study for my certification, and I'm gonna get it. So that's what I did. I freaking studied. I was the only one who applied that year. So I studied for my certification, and then I passed it. And oh my God, I passed it. And then because of the emotional intelligence, all that kind of stuff, I was back on good terms with everyone. And then I got my certification, and I was back on the top. I was freaking crushing it. And then I moved from pediatric hematology oncology, from bone marrow transplant unit, into a cancer center where I was dealing with pediatric oncology. And then there's a new manager, a new program director, and new all these kind of stuff. And the bullying started again. And this time, not from a coworker, but from my manager, basically. She heard about all the accomplishment that I've done in the past, and she was like freaking out. People like Western people in Saudi Arabia. She was from New Zealand, but I'm telling you, because like back home, you never know what their status. We had a lot of American nurses who go to Saudi Arabia, and then here they are nobody. Literally, they are nobody. They are not on good terms with their hospital. Their credit is fucking low. They are losers, basically. So the bottom of the bottom nurses apply to Saudi Arabia and go, and because of their like high self-confidence, their fluency in English, they get positions. They're blonde, blue eyes, they get freaking positions in Saudi Arabia. I'm gonna write a book about like nurse bullying or Western nurse bullying in Saudi Arabia at a later stage. I'm gonna mention names, facts, emails, all these kind of stuff. But so that her head nurse was like, because she was afraid on her position. She thought, I'm on the rise, and then I was transferred to her unit, then I might take her position. And you know, like how I do it is I go and execute on something, for instance, like a conference, sponsorship for a conference. So like this is what I do, and I don't think this is a great idea. I communicate with the conference, I send them like an application or whatever, and I say I want sponsorship. And then they do the, you know, they review my application, we have a few phone calls, and then they approve me. And then after I get approved for the conference, I go to my nurse manager and I tell her, oh, I got a sponsorship for this conference, and uh, I want like an annual leave. Then the nurse manager is in a position where, oh, should I give him the leave, or should I decline it and say you did everything behind my back, so go figure this out? So this nurse manager gave me a couple chances, but then she, hey, stop it. You're not going anywhere. And then this is when the bullying started. Anyways, we're going to continue this story maybe next week at a later stage. Now, you see Amani right there. Amani is sitting for her nursing interview today. And this video, we're gonna move to another video, and only Patreons can see it. And we're gonna review, you know, questions for the interview. So if you are not a Patreon, hey, that $5 will not hurt you. It's just like a monster and a cookie. It's just a representation that you are an Alphaslice and you would like to support this channel to see more content. So let's go to the next video.
Yeah.
When can ser sempre logo?